John, if I pulled you out of your position and took you to a completely new demographic, new location, you're on your own. I put you in a small clinic. It's yours. You've got no attachments initially with other providers, other clinicians, but you're wanting to see patients, and you're wanting to primarily go after those who are just those individuals suffering with the conditions, and therefore bringing into your practice a fair bit of responsibility as that primary care provider, all the way down to taking vitals or your paperwork. What are some of the things that you feel like, oh, if I did that, I would certainly make sure these things were addressed or these things were done with each patient?
Right. So first of all, on behalf of all physical therapists, I'd have a scribe so I could see as many patients as I could in a day. Number one, my son's dermatologist just does that. And I was like, I bet you see 50, 60 patients a day. He goes, I absolutely do.
Wow.
But yes, so vitals, that is something that the primary care docs do have. They do have generally a nursing staff or medics to do those kind of vital screens. Because there you already start with safety. Hey, listen, the blood pressure's too high. What's up with that? Did you take your medicine? What's going on? And they do a nice subjective examination. What are you here for today? So yeah, I mean, that's the Cadillac version. I've got somebody to screen some vitals and ask them the demographics. I don't know that I'm so concerned about, but what's your mental state today? What's your physical state today? At least give that primary care physician, primary care physical therapist an idea of what they're walking into. So I think you're right. That would be a great start. Trying to think fast here. I'm not that smart guy. I think, the thing is privacy. There are certain specialties, and I don't want to name any, but I think patient privacy is important, right? So if I had my own clinic, I like sometimes when you go into a door, like primary care, I've seen this, you go into a door, the nurse takes you back in one door, screens your vitals, takes you, eventually takes you to the physician. But guess what? You don't go back through that door. You go back through a side door, because people don't need to know that you went to the physician that day. And they don't need, oh, I saw you. Behavioral health is real good about that, generally in the military. We don't want a stigma. So I think that would be something for sure. Patient, I don't think we could ever do enough to do that. Other than that, obviously world-class physical therapy equipment. So, treatment tables, for example, world-class equipment. Doesn't need to be a lot, because, Michelle, my wife, and then Mark Miller and Scott Herbowie, Kim Green, we had a clinic like that, a satellite clinic at St. David's. But we had the best of everything we needed, and it was private. It was small.
Yeah. Some great things to think about. If you summed up your thoughts on physical therapists as a primary care provider in just a few words, John, what's that major message you would want listeners to come away with from our discussion today?
Yeah, I think that, first of all, it's a great discussion. It makes everybody feel good, but I think people need to understand there's a lot of responsibility comes with it, maybe more responsibility than they're understanding or familiar with. And I would just simply consider some of the things we've discussed, safety being number one, making sure, if you've got a problem with a patient, that you can get to a physician quickly and go, I think I got a problem. Can you help me? Can you help the patient? And no delay in that. And just know that you're not alone, and trust your teammates. But the idea that, so you just asked me a question about going out and having my own clinic. That'd be great. But I've been doing this a long, long time, and I've had a lot of mentors, and I've had a lot of training. And oh, by the way, Jason, I'd still make sure I had a landing net, so to speak, that I could reach out and touch some folks if I got myself in a jam. So those are the things. I think that hopefully that sums it up for people. I think it's a possibility for sure. I think it would take some load off the primary care physician's desk. I think that they treat everything. So I think in certain situations, it absolutely is appropriate for the physical therapist to be the first line provider.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.